afternoon, everyone. Thanks so much to Rosaleen and to Amyloidosis Ireland for inviting me to speak. Yes, I'm Grace. I'm a neurology doctor. I'm also a clinical lecturer in neuromuscular diseases in Northern Ireland. I work at Queen's University Belfast along with AJ McKnight, who many of you will know. And we just wanted to give a bit of an update in terms of rare disease research in general in Northern Ireland. A lot of this research has been initiated or led by a lot of the people in the room. It's very much been a team effort. Just wanted to emphasise that from the start because I feel like a bit of a fraud presenting some of this work. So as many of you will know, the Northern Ireland Rare Disease Action Plan was crafted with broad community support. It identified key priority actions that needed to be addressed to improve the lives of people living with rare conditions in Northern Ireland. So progress on this has been slower than hoped, and that largely comes down to a lack of government funding in this area. But we have made some progress. Most of that is down to goodwill and also due to successful research funding that's been secured. So one of the key areas that was identified that we needed to improve was how we diagnose rare conditions. So we know on average it takes about 6 years, 8 different doctors and 3 misdiagnoses before somebody with a rare condition reaches the right diagnosis. And we are on a research basis for select conditions now using new molecular technologies such as long-read whole genome sequencing and transcriptomics. And we can see for some conditions that leads to a definite reduction in how long it takes to reach a diagnosis. We've also done some work where we looked at patients, specifically children who had a genetic rare condition. And when we look back retrospectively, we can see that a quarter of children in Northern Ireland would have met the NHS England prenatal genetic testing criteria. And that's potentially saving them a diagnostic odyssey of 6 years. So really important information to have whenever we're trying to leverage for change in policy for how we screen for these conditions. We're developing a new tool. This is done between the Belfast Trust and Queen's University Belfast called Gen Oceanic. So this is a software tool that's going to be used with the idea of integrating electronic clinical records along with genetic testing results so that we can better interpret those results and understand what we're requesting. And alongside all of this, we're doing some health economic analysis because we know that what we really need to show at the end of all of this research is that there is a clear financial benefit to reaching a diagnosis faster for it to be integrated into our routine NHS care. Northern Ireland is small, but we punch above our weight in terms of being involved in development of quality standards for rare diseases. And we sit on national screening committees and newborn screening committees, which ensures we have a voice in terms of advocating what should be included in these registries and committees. We know that caring for someone with a rare condition has a massive impact on an individual and on the wider family. Many people who care for someone with a rare condition care for several other family members with that condition. So we've developed an online support tool, which we hope will go live next month. This tool is really crafted for carers by carers, and it provides essential resources for things like navigating accessibility advice, financial advice, and different signposting that we know from other lived experience has been really challenging for people. We're really committed to patient and public involvement and engagement in our research. So everything that we've done is either initiated, co-led or conceived by someone with lived experience of the condition. And that really helps to make sure that our research is impactful for patients and families. The People Living with Rare Diseases Experience of Research survey was conducted by the the Public Health Agency, University of Ulster and Queen's University Belfast just last year. And we hope that that will give us some more insight into the challenges that patients with rare conditions face when they're trying to become engaged in research. We do a lot of work on an all-Ireland basis, which of course is really important when you have a rare condition. It makes no sense to work in silos. The All-Ireland Rare Disease Interdisciplinary Research Network, or RAIN, is a network of over 100 different experts. There's representatives from all hospital trusts across the island of Ireland. It has launched the couple collaboration events, these are aimed at parents and caregivers for people with rare conditions. They're really excellent source of support. They also allow those people to have a voice in terms of directing what we should be doing as our research. And RAIN has also launched the Children's and Young Persons Research Advisory Group. This is a group that aims to improve the awareness of rare conditions for people among young people. The biggest substantive contribution to rare disease research in the UK, as far as I'm aware to date, has been the LifeArc Translational Centres for Rare Disease. These represent a £40 million investment, 4 different centres, and that's for 5 years. And we're really delighted that Northern Ireland has a foothold in this. So we are small players in the rare kidney disease LifeArc. This has been led by Liverpool. And we do have a small role, which we hope will mean that some patients here get access to trials that they wouldn't have had otherwise. But Queen's University Belfast is co-leading the LifeArc Centre for the Acceleration of Rare Disease Trials. This is also led by the University of Birmingham and Newcastle University. So the real focus of this centre is on digital innovation, improving patient-reported outcomes, and improving trial design and delivery for rare conditions. So the challenges faced by when you try to undertake a clinical trial for a rare condition are numerous. The main issues are around recruitment, the lack of having trial-ready cohorts, a lack of good natural history data, a lack of good outcome measures because these phenotypes are often very specific. We have difficulty keeping people in trials, and the trials are often not very patient-friendly. We can see that there's often a lack of capacity to deliver trials in some parts of the UK, and there's definitely been inequitable trial delivery across the 4 nations, and we can see that Northern Ireland is quite often left behind. And of course, at the other end, for rare conditions, there's a longer delay to regulatory approvals and to the implementation of these new treatments. And these are some of the things that the LifeArc Centre hopes to address. In Northern Ireland, we're really leading on a data focus aspect of this LifeArc. So we're going to create a consent register where people can sign up to be kept informed about research. We'll be developing a secure online recruitment portal where people can register their interest in clinical trials, and they can also access a library of clinical trials. And then Queen's is leading on the development of core data sets and standardised dictionaries for these rare conditions, which doesn't sound very exciting, but it's actually really crucial that we accurately describe these conditions whenever we're putting patients' clinical records down or we're putting them into registries, because if we haven't done it in a standardised way, we can't identify those patients for clinical trials. So this very much has a delivery focus. Of course, the overarching aim is just to get these treatments to the people who could benefit from them faster. The LifeArc Centre also comes with a new doctoral training programme for clinicians and scientists. There will be a rare disease support officer and a rare disease trials coordinator as well. And I think we're really positive that this should build a really strong foundation for rare disease research here in Northern Ireland that makes a sustainable infrastructure for rare disease research going forward. Of course, this is going to serve the entirety of the Northern Ireland population and all 110,000 people here living with a rare condition. This has been very much a team effort to get to this point, with input from over 60 rare disease charities and a lot of different clinical and academic expertise. And we're so grateful for all of that. Thank you so much.